Today, we will learn about the research methods in medical sciences. Research methodology is the backbone of any scientific study, especially in medical research where accuracy, ethics, and evidence-based practice are essential. It provides a systematic plan for collecting, analyzing, and interpreting data to answer a specific research question or test a hypothesis. A well-defined methodology ensures that findings are valid, reliable, and reproducible, contributing to better healthcare decisions and patients' outcome. What is a research? A systematic means of problem solving. Types of research. There are two main types of research: quantitative research or qualitative research. Quantitative research. Quantitative methods emphasize objective measurements and the statistical, mathematical, or numerical analysis of data collected through polls, questionnaire, and surveys, or by manipulating pre-existing statistical data, secondary data using computational techniques. In qualitative research method is primarily exploratory research. It is used to gain an understanding of underlying reasons, opinions, and motivations. It provides insight into the problem or helps to develop ideas or hypotheses for potential quantitative research. Research methodology. A research methodology is a term that basically means how research is done scientifically. It is a way to systematically and logically solve a research problem. Research design. Research design refers to the structured plan and strategy of any research project. Study design. A study design is a specific plan for conducting the study which allows the investigator to interpret the conceptual hypothesis into an operational one. There are two main types of study design: experimental and here we have the classification of research study design. Two main classification: observational and experimental. We further divide observational in descriptive and analytical. Descriptive observational design: case report, case series, and survey or cross-sectional. And analytical observational design is cross-sectional, case control, and cohort studies. The second classification is experimental design, further divided in two types: non-randomized trial and randomized controlled trial. Randomized controlled trial divided in parallel design and crossover design and others. Study design's purpose: to describe the current situation of any condition like prevalence, to investigate the relationship between exposure and outcome, to study new drug and their effects. A case report. Description of one interesting and unusual case. This is subjective and may form the basis for further study. This may be the only way to report on something very rare. Case report. A detailed report by the physician of an unusual disease in a single person, thalidomide Germany in late 1959 presented congenital malformation affecting the limbs of child. Advantages and disadvantages. Rare clinical event reported, unusual in explaining mechanism of disease and treatment. Disadvantages: susceptible to bias, report represented isolated event. Case series: description of several cases in which no attempt is made to answer specific hypotheses or compare results with another groups of cases. Defects and disability of thalidomide children. This article published the defects of 154 children are described and classified. Their disability range from incapacitating to negligible. The range of the defects and disabilities in thalidomide children is very much wider than is generally realized. This article is published in 1973. Conceptual diagram. Here, first, we describe the conceptual diagram of the exposure and disease pattern. First, we draw sample from the defined population and divided exposure positive and negative and disease positive and negative. Beings with start disease and exposure at same time. Exposure and outcome. Exposure, possible risk factors, causes or determinants, measure that may be associated with outcome, independent variable. Outcome, health outcome of interest in the study, disease, side effects, complication, that dependent variable. Classification of study design. Descriptive study design, case report, case series, cross-sectional studies, analytical studies, case control studies, cohort studies, cross-sectional studies, experimental or interventional. Compare treatment modalities studies as control trial, randomized control trial, and non-randomized control trial. This is the diagram for cohort study, case control studies, and cross-sectional studies. Here in cohort study, start with exposure and end with outcome, and case control study start with outcome and we find out the exposure among the groups. In a cross-sectional study, we have same time exposure and outcome. We find at the same time exposure and outcome. Cross-sectional study design. A survey of the frequency of disease, risk factors, or other characteristics in a defined population at one particular point in time. The design diagram of the cross-sectional study is define the first population, gather data on exposure and disease simultaneously, exposed have disease, exposed do not have disease, not exposed have disease, not exposed do not have disease. This is the 2 by 2 cross tabulation for cross-sectional study design. Cross-sectional study design, also called the prevalence studies. A cross-sectional study is a survey of population at a single point in time. An interview survey, a mass level screening program, for example, National Health Survey of Pakistan on the prevalence of hypertension in Pakistan. Pakistan National Diabetic Survey, prevalence of DM in Pakistan. Advantages and disadvantages for cross-sectional study. The features is provide a snapshot picture, exposure and disease assessed simultaneously, information based on individuals, single interviews or examinations. Strength, baseline information, healthcare planning, hypothesis generation, changing pattern, repeated survey, limitation, chicken or egg dilemma. Cohort study design. A cohort study design an observational study for a group of people with a specific characteristics or disease who are followed over a period of time to detect changes. Comparison with control groups is allowed. This is the flowchart diagram for cohort study design. First, we define our population and non-randomization exposed and non-exposed group we divide. First, we divide our exposed group in develop outcome and do not develop outcome and non-exposed group in develop outcome and do not develop outcome. Classical example of a cohort study, the Framingham study. Framingham is a town about 20 miles from Boston. Residents were considered eligible if they were between 30 to 62 years of age. A sample size of about 5,000 men and women. Many exposures were defined such as smoking, obesity, elevated blood pressure, elevated cholesterol level, two level of physical activity, etc. Outcome: new coronary event identified by examining the population every 2 years and by daily surveillance of hospitalization. The advantages and disadvantages of cohort study. Temporality, exposure, proceed, outcome because cohort is disease free at baseline. Efficient for the study, rare exposures may be used to study multiple outcome, allow allows for calculation of incidence of disease in E plus, exposure plus and exposure negative individuals, minimize the recall bias. Disadvantages: expensive, time consuming, loss to follow up, insufficient to study rare disease, selection bias. Case control study design. This is an observational study design where characteristics of people with a disease cases are compared with selected people without the disease control ones. Definition of case and control in case control study design. At baseline, selection of cases or disease and controls non-disease. Case definition. Diagnosed with breast cancer, incidence newly diagnosed between the time period 92 to 93, resident of Geneva, aged is less than 75 years, identified all pathology labs of Geneva. The definition of controls never diagnosed with breast cancer between 92 and 93 and resident of Geneva, aged less than 75 years, randomly from Geneva population. The flow diagram of case control study. Case control study starts with cases with disease and we find the exposure or exposed and unexposed and start the controls without disease and we also find the same thing exposed and unexposed. Control trials. An experimental study in which an intervention is applied to one group and the outcome compared with that in a similar group controls, not receiving the intervention. Randomized control design. Gold standard of all studies, prospective studies design, two or more groups assigned by randomization, take baseline measure on all groups, give different treatments, measure outcome. Types of clinical trials. Treatment trials test experimental treatments, behavioral therapies, new combination of drug or new approaches to surgery or radiation therapy. Prevention trials looks for better ways to prevent disease in people who have never had the disease or to prevent a disease from returning. These approaches may include medicines, vitamins, vaccines, minerals, or lifestyle changes. Diagnostic trials are conducted to find better test or procedure for diagnosing a particular disease or condition. Diagnostic trials are conducted to find better test or procedure for diagnosing a particular disease or condition. Screening trials. Screening trials test the best way to detect certain disease or health conditions. Quality of life trials. Supportive care trials explore ways to improve comfort and the quality of life for individuals with a chronic illness. Investigation sequence. Case reports, case series, and descriptive studies, clinical trials, preventive and therapeutic experimental studies, analytical studies, epidemiological studies, cohort studies, case control studies, and cross-sectional. The purpose of the study and its ideal study design. The first purpose is to estimate the prevalence of disease. The design is cross-sectional. The second purpose, to determine the natural history of a disease. Cohort design is the best for this purpose. The purpose to identify the causes of risk factors or people at high risk. For this type of studies, we use cohort and experimental study design. To prevent disease, for this purpose, we use experimental study design, and to alter course of disease, for this purpose, we use experimental or randomized trial design. Here we have a diagram for the strength of the study. In vitro test tube research is the last or end point. Animal research, ideas, editorials, opinions, and the case report, case series, case control studies, cohort studies, randomized control, double-blind trials, and the superior one is systematic reviews and meta-analysis. Thank you so much. Please subscribe and like our channel and press bell icon for more videos. Please subscribe and like our channel and press bell icon for more videos.